So I'm Andrew Langley. I'm a public health physician and director of the public health unit within the hospital and health service. So you're aware of our media release, which related to the tragic death of a woman in her late 30s over the weekend. It's the first case we've had on the Sunshine Coast area this year, so it's even more unfortunate that it's had such a tragic outcome. The mortality rate with meningococcal disease is about 5 to 10%. Even when it's treated early, sometimes there's just progressive deterioration. So you can't fully rely on antibiotics. So we try and prevent it by the use of vaccination, and the most widely used vaccine that we've got was the meningococcal C vaccine, and we've seen dramatic reductions in meningococcal type C since it was introduced. So, for instance, we haven't had a meningococcal type C on the Sunshine Coast since before 2008. I've gone back through our records. We haven't had a death here from meningococcal disease for some years. Again, we've looked back to 2008 and not seen any cases. So some people can be very sick, and you'd be aware of one instance in a toddler 18 months ago, where that child was obviously very severely ill. So it's a rare disease. In a full year, last year we had 6 cases on the Sunshine Coast, the year before 5. So this is our first on the Sunshine Coast this year. In Queensland, we've already had 5 cases so far this year. So our message that we're trying to get across is to vaccinate, because it is effective, and it seems to have stopped the spread of meningococcal disease circulating in even the non-immunised population. There's more recently been a serogroup B vaccine introduced. It's too early to say what the outcomes of that will be, but we expect it to have an impact on that. But that's not widely used at present. The public health unit follows up the contacts of cases. So we're particularly concerned about the close contacts of cases, by which I mean people with close and prolonged contact, such as household members. It's quite uncommon to see second cases, but they can occur. We give antibiotics to that relatively small group of household or household-like contacts to make sure that none of the contacts are carrying it. The meningococcal bacteria is often commonly and harmlessly carried in the back of our throats. It's present in about 10% of people at any one time. Occasionally, and for reasons we're not fully aware of, whether people have a chink in their immune system, it can shift from being in their throats to affecting the rest of their body, and we see severe illness. Some people who develop meningococcal disease have had a preceding upper respiratory tract infection, which would appear to inflame the back of the throat, and perhaps that disrupts the sort of barrier there. Others have had no obvious illness. just become rapidly ill. So with the close contacts, we've been following those up and also talking to broader contacts. People who've had casual contact, we reassure, but provide them with the signs and symptoms of disease in the rare instance that they might develop it. And it's useful for people to know them anyway, because you can get meningococcal disease at any time in your life, but the highest rates of infection are in very young children, and there's another group between 15 and 25 years of age who are at heightened risk, but we can see it in other groups of